All right, so we're diving deep today into chronic pain.
Oh, yeah.
And, it's something that we've touched on, I think, in a lot of previous episodes, but
Yeah, it pops up everywhere.
it really does.
Like, it's sort of unavoidable, right?
Yeah.
Once you start talking about, like, health and the body and well-being.
Right.
And, but today we have a really great collection of resources.
We do.
So we have kind of the practical everyday advice from sources like WebMD.
Yeah, the go
Johns Hopkins Medicine, Cleveland Clinic.
Yeah.
But then we also have this NCBI bookshelf report. And this one focuses specifically on managing chronic pain for people who are either dealing with substance use disorders currently or are in recovery.
Right, and that adds a whole other layer of complexity
Oh, absolutely.
to an already really complex issue.
Yeah.
So I think what's really apparent just from glancing at this material is that
The scope.
the scope of it all.
It's huge.
It's huge. And then also just how many different factors play a role.
Oh, yeah. So many moving parts.
When pain becomes chronic, when it's not just something that goes away.
Right, right. It's not just like, you tweak your back and you're sore for a couple of days. This is a whole different ballgame.
Yeah.
And what's so cool about this set of materials that we have is we kind of get this like panoramic view, right?
Yeah.
There's like we go from the very basic understanding of what chronic pain is, how it impacts people, all the way to the very, very specific, nuanced considerations for a particular population.
Right. And a vulnerable population.
Yes, absolutely. At that. So it's a fantastic opportunity to, not only like recognize the commonalities, the common threads that we see in managing chronic pain in general.
Right.
But also to see like where are the crucial differences, right?
Oh, right.
Where do we need to adjust our thinking?
Yeah. Where does the approach need to be totally different based on individual circumstances?
100%. So our goal today is to pull out, some of the most important and maybe some surprising insights from all this material.
It makes sense of it all.
Yeah, exactly.
Yeah.
So that you, dear listener, come away with a much clearer picture.
Right.
Of what the landscape of chronic pain management looks like.
Yeah, what options are out there.
Right, exactly.
Yeah, okay.
Yeah.
So I think a good place to start is just with the basics, right?
Yeah, always a good place to start.
What exactly is chronic pain? Because it's not just your everyday, oh, my knee hurts or I slept wrong, right?
Right. Exactly.
It seems like all of our sources agree on this.
Yeah.
That it's not just that.
It's not just a fleeting thing.
So what is it?
So the consistent definition across the board is pain that persists for more than 3 months.
Okay, so there's a time frame.
Yeah, there's like a line in the sand.
Right.
3 months. If it's still hanging around after 3 months, that's when we start thinking, okay.
It's chronic.
It's chronic.
Yeah.
And both Johns Hopkins and the Cleveland Clinic make a really important point.
Okay.
Which is that the pain doesn't necessarily have to be constant.
Oh.
It can come and go.
So it can be intermittent?
It can be totally intermittent.
Wow. Okay.
So it's really not just about like suffering 24/7.
Right.
It's about this, like the ongoing nature of it.
The persistence.
Yeah, to persistence.
Yeah.
That's what makes it chronic.
Okay, that makes sense.
Yeah.
So, I mean, just thinking about that time frame, the fact that it could be something that comes and goes for 3 months or more.
That's a long time.
That's a long time.
Yeah.
And I think it's really significant to point out just how many people are dealing with this.
Oh, yeah. The numbers are kind of shocking, actually.
It is, yeah.
The Cleveland Clinic points out that in 2021.
Okay, so fairly recent data.
Yeah, very recent. Over 20%
wow.
of adults in the U.S. were living with chronic pain.
So more than 1 in 5.
Yeah, more than 1 in 5 adults. It's huge.
That's a huge portion of the population.
It's really it underscores why this deep dive is so important.
Absolutely.
Why we really need to understand this.
Yeah.
And both Johns Hopkins and Cleveland Clinic go into detail about the impact.
Yeah.
Like how it affects people's lives.
Right.
And they talk about how it interferes with daily life.
Yeah. They mention things like, work and eating and exercise.
All the basic things.
And even just like enjoying your life.
Right. Exactly. The things that like make life worth living.
Yeah.
Those things get impacted.
And you don't think about that when you think about pain.
Right.
You just think about the physical sensation.
Yeah, you think about like, ouch, my back hurts.
Right.
But it's so much more than that.
Right. And it's so interesting. Johns Hopkins even uses this term terrible triad.
Oh, yeah.
And it really kind of paints a picture of how debilitating this can be.
It does. It shows how connected it is.
Yeah.
The physical pain and then what happens mentally and emotionally.
Can you talk a little bit more about that?
Yeah, so the terrible triad,
Yeah.
it describes this cycle
Okay.
where you have the pain, obviously, right?
Right. The physical pain.
Persistent pain.
Yeah.
And then because it's persistent,
Yeah.
people start to fixate on it.
You're constantly thinking about it.
You're constantly thinking about it, right?
Yeah, yeah, yeah.
And so that fixation leads to, often depression, feelings of hopelessness, maybe irritability.
Right, right.
And then those emotional states
Yeah.
really disrupt sleep.
Of course, yeah.
And then, you're exhausted all the time, you're
Yeah.
fatigued, and that just kind of feeds back into the irritability and the low mood.
Makes everything worse.
Exactly. So it's like this downward spiral.
And it's this, terrible triad of,
Yeah.
of suffering.
Yeah.
It's really striking.
It is.
And you think about the impact of this. I mean, we were just talking about the individual level,
Right.
how it affects your life and everything.
Yeah.
But Johns Hopkins also touched on the economic impact.
Oh, yeah. Huge.
Increased healthcare costs,
Right.
lost productivity,
Still can't work.
reduced income. It's a societal issue.
Yeah, it really is.
Yeah.
And one thing that Johns Hopkins pointed out that I think is particularly important to mention
Okay.
is that because people are, obviously desperately looking for relief,
Right.
they sometimes end up seeking out treatments that are unproven
Oh, right.
or even harmful.
Yeah. Yeah.
Or they go down the road of drug dependency.
Right. Yeah. It can lead to risky behavior.
Absolutely. Yeah.
Just to try and feel better.
Yeah. Desperation.
Yeah.
Yeah.
So, all right. So we have a good sense of what chronic pain is, how widespread it is.
The impact.
The impact of it, yeah.
Okay.
So now let's dig into, okay, what are the different types of chronic pain and what causes it?
Okay. Yeah. That's a great next step.
The Cleveland Clinic had a really helpful breakdown of kind of the general categories.
Yeah, their categorization's really useful, I
Yeah.
think,
Yeah.
for understanding like where it's coming from.
Right, yeah.
So they talk about neuropathic pain,
Okay.
and this is pain that comes from damage to the nerves themselves.
Okay, so that's different than
Ooh.
like a muscle pain.
Totally, yeah.
Right.
Then you have musculoskeletal pain,
Okay.
and that's like our, bones, joints, muscles,
Familiar.
the stuff we think about.
Yeah.
Visceral pain.
Okay.
So that's pain that's coming from the internal organs.
Okay.
Inflammatory pain,
Okay.
which is a result of tissue damage,
Right.
and then central sensitization.
Central sensitization. Okay.
So that's where your nervous system basically changes,
Oh, wow.
and you become more sensitive to pain signals.
Okay, so your body's pain system is
It's basically amplified.
amplified, yeah.
Yeah.
Okay, so it's interesting that there's like all these different like
Origins.
origins of chronic pain.
Yeah, and I think that speaks to why it's so hard to
Right.
figure out what's going on sometimes.
Yeah, to get an accurate diagnosis.
Exactly, because it can be so different from one person to the next.
Right, and you can have more than one thing going on too, right?
Oh, absolutely. Yeah, the Cleveland Clinic makes that point.
Yeah.
That it's not uncommon to have, overlapping causes.
Right, so you could have something that's both.
Right. It could be like a nerve issue and a muscle issue.
Right, okay.
Anything.
And something else that both Johns Hopkins and Cleveland Clinic mentioned,
Yeah.
which I think is really important
Yeah. It's crucial.
to remember, is that sometimes they can't find a direct physical cause for
Yeah.
the pain.
And that's what they call psychogenic pain.
Right, psychogenic pain.
And it's important to remember that doesn't mean the pain isn't real.
No, absolutely.
It's very real.
Oh, it's just that the origin.
The origin might be more linked
Okay.
to psychological or emotional factors.
Right, it's all interconnected, right?
Exactly.
The mind and body.
It's all one system.
Yeah, it's not
Yeah.
separate.
Yeah.
Okay, so there are also some risk factors, right?
Right. There are some things that might make you more prone to developing chronic pain.
Okay.
The Cleveland Clinic kind of gave a rundown of these.
Yeah, they mentioned genetics.
Right. So some people are just,
Predisposed.
predisposed.
Yeah.
Aging naturally.
Yeah.
As we get older, things start to wear down.
Right.
Previous injuries.
Yeah, if you've had a bad injury,
You're more likely
Right,
to have
okay.
chronic pain later on.
makes sense.
Jobs that involve a lot of manual labor.
Okay.
So if you're, lifting heavy things all the time.
Yeah, putting a lot of strain on your body.
Yeah, exactly.
Yeah.
Frequent or intense stress,
Okay.
so that mind-body connection again.
You're right.
Smoke and obesity.
Okay, so I mean that's a pretty wide range of things.
Yeah, it is. It's not like one specific thing.
Right.
It's a bunch of different things that can kind of like increase your risk.
Right. So anyone could potentially develop chronic pain,
Absolutely.
but there might be certain things that make you a little bit more susceptible.
Exactly.
Okay, so now we have like this
Yeah, I
foundation
got the basics down.
of what chronic pain is.
Right.
So let's move into treatment.
The big question.
Right.
How do we deal with this?
Yeah, so WebMD did a really good job, I thought, of kind of laying out all the different options.
Oh, yeah, they have a really comprehensive overview
They do.
of the different approaches.
But they also make a really important point,
Right.
which is that there's no magic bullet.
Right, there's no one-size-fits-all solution.
Exactly. It's rarely just one thing.
Yeah, it's usually a combination of approaches.
Right. And finding that right combination.
Just a process.
Yeah.
Yeah, for sure.
Okay, so let's start with drug therapy.
Okay, so medication.
Yeah, because I think that's probably what people think of first.
Yeah, it's often the first line of defense.
Yeah.
Yeah.
So WebMD talked about both over-the-counter
Right.
and prescription options.
Yeah.
So for more mild pain, they mentioned acetaminophen.
Right, so Tylenol.
Right, Tylenol.
NSAIDs.
NSAI, so that's like ibuprofen, naproxen, aspirin.
Exactly. Yeah, all those common ones.
Right.
And they also mentioned topical pain relievers.
Oh, right. So the creams and the gels.
Yeah, the creams, the lotions, the sprays.
Yeah.
You know, you rub it right on the spot where it hurts.
Yeah.
So those are all good for kind of general aches and pains.
Right. And are NSAIDs more for inflammation or?
So both acetaminophen and NSAIDs can help with kind of just general pain,
Okay.
but NSAIDs have that added benefit of reducing inflammation.
Okay, so if you've got some swelling or,
Yeah, if there's like an injury
Right.
that's causing the pain, the NSAIDs could be really helpful.
Okay.
Yeah. But then for more persistent pain
Right.
or severe pain,
Yeah.
doctors might prescribe, stronger medications.
Right. And they gave a whole bunch of examples.
They did. Yeah, they talked about muscle relaxants,
Muscle relaxants, yeah.
anti-anxiety medications
Oh, interesting.
like diazepam,
Okay.
which is also known as Valium,
Oh, wow.
antidepressants.
Okay.
And this might seem kind of strange,
Yeah.
but certain antidepressants
Yeah.
can actually be really effective for nerve pain.
Oh, interesting.
Yeah, so for example, they mentioned duloxetine,
Okay.
which is also known as Cymbalta,
Okay.
and that's often prescribed for things like musculoskeletal pain.
Oh, okay.
They also mentioned stronger NSAIDs,
Okay.
so like celecoxib, also
Okay.
known as Celebrex.
Right.
And then sometimes,
Yeah.
for shorter periods,
Okay.
they might prescribe stronger painkillers.
Right. The opioids.
Yeah, opioid.
And that's a whole other can of worms, but we'll get to that, I'm sure.
Oh, yeah, we'll definitely dig into that.
Yeah.
So some of the common opioids they mentioned were codeine, fentanyl, oxycodone with acetaminophen, so that's like Percocet,
Okay.
hydrocodone
Ah,
with acetaminophen, which is Vicodin.
right.
So those are,
The brand names.
the brand names, yeah.
Yeah.
And then they also talked about steroid injections
Oh, right.
and epidural injections,
Okay.
which are often used for specific types of pain.
Like back pain.
Yeah, like spinal stenosis
Okay.
or lower back pain.
Okay. And it's interesting, they did mention that FDA warning about NSAIs.
Oh, yeah, that's important.
The risk of heart attacks and strokes.
Right, and stomach ulcers.
Yeah, especially if you're taking them for a long time.
Right, or at high doses.
Yeah, so that's, something to be aware of.
Absolutely, always talk to your doctor.
Right, always talk to your doctor.
And they also talk about nerve blocks,
Nerve blocks, yeah.
which is where they inject a local anesthetic
Okay.
to basically interrupt the pain signals.
So it blocks the pain signal.
Blocks it right at the source.
Wow, okay.
And these can be really effective,
Yeah.
but they're not always a good option.
Okay, why not?
Well, sometimes it's just not possible,
Okay.
like depending on where the pain is.
Oh, okay.
Sometimes it's too risky
Okay.
to do the injection.
Right.
And sometimes it's not the best treatment
Right.
for that particular type of pain.
Right, so it's not like a cure-all.
No, definitely not.
Yeah.
And then they also talked about patient-controlled analgesia.
PCA,
Yes,
yeah.
PCA.
Yeah.
And that's where the patient actually controls
Right.
the pain medication.
Through a pump.
Yeah, through
Yeah.
the pump.
Yeah.
And it's often opioids
Okay.
that are used in this.
And they mentioned that's typically used for...
Yeah, it's usually for like right after surgery or trauma.
Right.
or for managing cancer pain.
Okay, so it's more of a...
Yeah, it's for more acute situation.
Right, right, not necessarily chronic.
Right, exactly.
Okay.
Yeah.
So that was a lot of different medications.
There's a lot out there.
There is, yeah,
Yeah.
and I imagine, again, it's finding the right one, the
Absolutely.
right combination for the individual.
Yeah, and WebMD also talked about trigger point injection.
Trigger point injections, yeah.
And these are for those like really tight,
Yeah, the knots.
the knots, yeah, the muscle knots.
Yeah,
You can get like in your back, your shoulders, your neck.
yeah,
And so what they do is they inject
right into that spot.
right into that trigger point.
Yeah,
A local anesthetic.
okay,
Sometimes they combine it with a corticosteroid.
okay.
And that can help like relax the muscle and reduce the pain.
So it's not just numbing it.
It's not just numbing, it's actually trying to address
Address that knot.
yeah, the underlying tension. And trigger point injections are used for pain in various areas.
Yeah, they mentioned arms, legs, back, neck.
Yeah. And then also for conditions like fibromyalgia,
Okay,
tension headaches,
yeah,
and myofascial pain syndrome.
okay.
And it was interesting, they also mentioned Botox.
For migraines, right?
Yes, for chronic migraines.
Yeah,
So they inject Botox around the head and neck.
okay.
And this is typically done every 12 weeks.
Okay, so every 3 months.
Yeah, every 3 months.
Wow.
And it can provide relief for up to 3 months for some people.
Okay, so it's not like a permanent solution.
No, but it can be really helpful.
Yeah.
Yeah.
And then we get into surgical implants.
Okay, so this is, getting a little more invasive
Yeah, this is what
when the other stuff hasn't worked.
the other treatments haven't been enough.
Right, exactly. WebMD talked about 2 main types.
Okay.
The first one is intrathecal drug delivery systems.
Intrathecal, wow, big word.
Yeah, it's a mouthful. But it's basically a pain pump.
Okay, so it's an implanted device.
Yeah, they surgically implant this device.
Okay.
And it delivers medication directly to the spinal cord.
Wow.
Yeah.
And what kind of medication are we talking about?
It could be things like morphine,
Okay.
muscle relaxants.
Okay.
And the advantage of this is that you can get really good pain control
Okay.
with lower doses of medication.
Oh, so you don't need as much.
Yeah, because it's going right to where it needs to go.
Right, directly to the spinal cord.
Yeah.
Wow.
And that also means fewer side effects.
Oh, okay, so that's a big plus.
Yeah, definitely.
Okay, and what was the other type of implant?
The other one is spinal cord stimulation.
Spinal cord stimulation.
Yeah, and so this involves implanting a device
Okay.
that sends these low-level electrical signals
Okay.
to the spinal cord.
And what does that do?
So the idea is to block the pain signals
Oh, okay.
from traveling to the brain.
So they never reach the brain.
Right. They get intercepted. And this is often used for chronic back pain and limb pain.
Okay.
And what's cool about this is that the patient can actually control
Oh, wow.
the intensity of the stimulation.
So they can adjust it based on...
Yeah, based on how they're feeling.
Wow, that's amazing.
Yeah, that's pretty cool.
So technology is like really playing a role
Oh, yeah.
in pain management.
Absolutely.
Yeah.
And WebMD also talked about 10,
10S, yeah.
which stands for transcutaneous electrical nerve stimulation.
Okay, that's a mouthful.
Yeah, it's a big one.
Yeah, but 10NS is much easier to say.
Right, 10NS is the common term.
Yeah, so what is that?
So it's basically where they use these electrodes
Okay,
on the skin,
okay,
and they send a low voltage electrical current
okay.
through those electrodes.
And what does that do?
So the idea is to kind of scramble
Scramble.
the pain signals.
Okay, so the signals are still there, but they're...
They're not getting through properly.
Okay.
Yeah.
Interesting.
And WebMD mentioned that it can be helpful
Yeah,
for some types of pain.
like diabetic neuropathy, they mentioned.
Exactly, yeah, diabetic neuropathy.
But they also pointed out that the American Academy of Neurology
Okay.
doesn't recommend it for chronic low back pain.
Oh, interesting.
So again, it depends on the type of pain.
Yeah, the location, the cause.
Yeah.
So it's not a universal solution.
Right, right.
Yeah.
And then we looked at bioelectric therapy,
Oh, yeah, bioelectric therapy.
which is another way of kind of using...
Yeah, it's another electrical stimulation therapy.
Okay.
But the idea with this one is that it not only blocks the pain messages,
Okay.
but it also encourages your body to release its own natural painkillers.
Oh, the endorphins.
Exactly, endorphins.
Yeah.
And this can be used for various conditions.
Yeah, they mentioned back pain, muscle pain, headaches, arthritis.
Yeah, lots of different things.
Yeah.
And the benefit of this is that it can provide temporary relief, and it can potentially help people reduce their medication doses.
Oh, okay.
Yeah,
So that's a big plus.
yeah, definitely.
Um, Now shifting gears a little bit.
Okay.
Um, Physical therapy and exercise.
Yeah, these are like the cornerstones.
Right. These are the things that I think sometimes people,
Don't want to hear.
yeah, they don't want to hear, but they're so important.
Oh, they're so important.
Right.
Yeah, because it's not just about masking the pain.
Right.
It's about actually addressing the underlying issues.
Right. So physical therapy, it's all about improving movement,
Exactly.
strength, function.
Yeah, getting you back to doing the things you love.
Yeah, and they use a variety of techniques, right?
Right. They might do like stretching, strengthening exercises. They might even use 10S
Oh, okay.
as part of the treatment.
Interesting.
Yeah.
And then exercise in general.
Yeah, regular exercise is so crucial.
So chronic pain, really.
Yeah, because it helps, improve your muscle tone, your strength, your flexibility.
Yeah, makes sense.
And it releases those endorphins.
Right, so that's that natural pain relief.
Yeah, exactly.
Okay.
And they mentioned some good examples like swimming, biking, walking, rowing.
Yoga.
Yeah.
So a lot of low impact stuff.
Yeah, you don't have to be like pounding the pavement
Right,
to
right.
get the benefits.
Oh, okay. So now we're moving into like the non-drug, non-invasive options.
Right, and we've got a lot to cover here.
You do.
But before we dive into that, I think it's really important to talk about the psychological aspect.
Oh, yeah, because we've alluded to this a little bit.
We have, yeah, the mind-body connection.
Right, and it's so important.
It really is, because chronic pain, it affects everything.
Right.
It affects your mood. It affects your relationships.
It affects how you view the world.
Absolutely.
Yeah.
And so both WebMD and the NCBI report
Yeah.
emphasize the importance of incorporating psychological treatment
Okay.
into the overall management plan.
So what does that look like?
So it can involve a lot of different things, but the main goals are to, address those negative feelings.
The anger, the sadness.
Yeah, the hopelessness.
Yeah.
They can come with chronic pain.
Right.
To provide education about pain,
Okay.
to help people develop coping skills.